we just want to broach the idea of clinical trials as a career to as many students as possible.
It's so exciting and so vital. It's so nice to hear you using words like pipeline and diversity and getting to the root cause of this problem, of this challenge that we've been facing in this industry for decades. What would you say to somebody who's listening to this and maybe they're in a different part of the country? They haven't developed a program yet, but they are inspired by what you're doing and they want to do something at the grassroots level. How do you start? How do you kickstart this? Sounds like it's networking and organization is a lot of it.
Yeah, it really is. And for us, again, we started this was something we did without really any budget, dedicated to this. Maybe we will get to the point where we have dedicated funding where we can really grow the program. But it, like many things, took a group of people who were excited by the idea and willing to volunteer their time. Our program administrator who works on it, super organized, really great at following up with people, getting people to commit, and sort of just going out to our friends in the cancer center and the non-cancer side as well and saying, hey, we want to do this type of program. Would you be interested in helping us out? And then going out to the schools. Again, we found these first two schools were great partners. They were really invested in finding resources for their students. So that it's out there, and it is really was it Mark Twain who said, I've always relied on the kindness of strangers. I don't know if that was his quote or not.
Tennessee Williams, Blanche Dubois, Tennessee Williams, I think.
Tennessee Williams. Thank you.
Right,
Yes.
right.
Yeah, right. So it's sort of going out and relying on people's goodwill. People are willing to do this type of work. And I would say one thing that we're planning on doing, again, looking for a diverse variety of speakers, both within the cancer center and then looking beyond that, going to ACRP's membership and saying, we have this program. Do you want to get involved? Is this something that you want to do? And seeing if there is, so we can get more speakers, right? And we can kind of lift that up. And I would say, if you are somewhere in the country where you think maybe I don't have that resource, you can maybe look to ACRP or another organization. Maybe look outside your institution if you don't have the resources within, and you can do it on a shoestring, right? It's really about engaging, and I would say too, it can take many different shapes. Our program sort of was shaped by our experiences and our resources, what we could do. It was sort of that idea of, take what you have and do what you can do. And it can be, like I mentioned, University of Pennsylvania, Children's Hospital of Philadelphia, Drexel University. They're all universities in Philadelphia, and they are doing things as well, but albeit differently than how we're doing it. So I would say, I think the biggest thing is starting. Just do something. And again, I think if people see this and they want to connect and talk about it, I would be happy to talk about the program and share my experiences.
That's great.
Yeah.
Right. Every journey begins with the first step. Christopher, thank you so much for joining us. This is really inspiring, and I'd love to check in with you down the line and see how the program is impacting people. It's obviously having a positive impact already. Thank you so much for joining us.
I appreciate the time. Thank you so much.